Scroll Toyota, leading the way every day. And Scroll Toyota, symbols of trust.
The Ocean View Middle School gym in Agate was the site of the first emergency medical services triage training for Guam's local nurses and firefighters. EMS Administrator Marlene Carbolito says this training ties into the activities under Nurses and EMS Week. It also falls under a federal grant program that helps emergency responders become better prepared.
This training is for the nurses on Guam. That includes the public health nurses, the Department of Education nurses, nurses from GCC, and the Guam Fire Department EMTs as well. And so they train together so that we can provide the best possible care for our children in case of disasters.
Carbolito also says they provided disaster bags as well. She mentions the triage training combines simulated scenarios of different emergencies that could happen on a school campus. This includes scenarios involving an active shooter, an earthquake, and food poisoning. Carbolito notes fire recruits volunteered to act as injured patients, while nurses from GCC and DOE trained on what they would do under certain situations.
You're going to see simulated injuries like gunshot wounds, crush injuries, bleeding, any of that. What the nurses do is they rapidly go and assess the patients to ensure that those who are really sick, the most critically sick, go to the hospital first. So they're actually doing a process of assessment called triage, and that's what this whole training is about.
GFD Lieutenant Jarrell Cruz says they are mentoring the nurses to ensure everyone is on the same page and responds in a timely manner. He adds they want the nurses to act more like firefighters and less like nurses in disaster situations.
Nurses are more clinicians in that they do more vitals check. They're into checking the whole patient, and in a mass casualty you have 30 seconds is the national average when you should check one patient and move over in a mass casualty situation, and this is what we do on a daily basis. So we came to show them how we do it.
Carbolito and Cruz both say the training is still in its early stages, so they plan on doing more scenarios in the near future and getting the Guam Memorial Hospital involved in some manner.
We still have to incorporate unified commands, other agencies, how we communicate with them, and how we're going to transport these patients in a mock situation like this. So yes, there's definitely more training to be done.
Josh Dukenko, PNC News.